Hello, everyone. Thank you so much for joining us tonight for our virtual Wellness Center event here at CAPS. It's actually a perfect night to be inside and not have to come into the office for the event. So we're glad that you can join us. We will get started here in the presentation with just a minute, but I wanted to let you know throughout the presentation, please feel free to use your chat button on the bottom or the question button if you come up with any questions at all. I'll be in the back and I'll answer as many as I can. Otherwise, we're going to have a question and answer session at the end. If we don't get to your question by the end, we want to be cognizant of everyone's time tonight. Please rest assured that we will get you an answer. We will email you your answer in the next couple of days, but we will go ahead and answer as many as we can throughout the presentation. And don't make sure you tune into the end too, because we also have a great package for the Wellness Center event. So you'll want to hear that as well. So without further ado, Julie and Emily will get started.
Thank you, Laura.
Oh, wouldn't you know it? It's always the technical problem. Let me get this share screen going for them really quick. Oops. Well, I got the screen going and now it took the Zoom off. Always something. Okay. Let's get back to the beginning. There we go.
Thank you,
Without
Laura.
further ado, thank you.
All right, thank you. Hi, everybody. I'm Julie Grafmeyer. I'm one of the nurse practitioners here at the Wellness Center. This is Emily. She is our other nurse practitioner here at the Wellness Center. And as Laura alluded to, the rain has just been crazy all day, so it's not doing any favors to our hair. So we apologize up front, but you know, what are you gonna do? So we're gonna introduce ourselves a little bit here, and then Emily's gonna talk for a while, and I'll come back in at the end. And like Laura said, if you have any questions, please feel free to share them with us. We are here for you guys. We're, you know, whatever you need, we're here to answer or help. So like I said, my name is Julie Grafmeyer. I'm one of the nurse practitioners here at the Wellness Center. And just to give you a little bit of background on myself, I've been a nurse practitioner now for, geez, almost 17 years. I started my career at Cleveland Clinic, and I think we may have lost our video, Laura, but maybe it's back. I don't know. Can you guys see us? I'm not sure. Go get her. I'm going to keep talking. If you can't see us, hopefully you can hear me, but just somebody type a little message in and see if you can and let us know what's going on. Okay, so I started my career at Cleveland Clinic in cardiology and thoracic surgery, all acute care medicine. When we moved down here to Columbus about 10 years ago now, I worked at the James, Riverside, all hospital medicine, all acute care, but I was always that nurse. I was raised very functionally. Can you see us? Okay, good, because this is what I see.
That's all right. That's okay. My videos.
Okay,
yeah, we got you.
Okay, never mind. Perfect. Okay, hopefully, see technology. What are you gonna do? Okay, so all like I was saying, all really acute care hospital medicine, and then I was always that nurse that would talk to my patients about food and lifestyle and sleep and, you know, what can we do to keep you out of the hospital? I was raised very functionally. I had a grandma that grew up in Appalachia. I watched her as a young child do yoga every day, only wash her hair in rainwater, eat homemade yogurt, all of those kinds of things. And I thought that was normal. When I moved out to Cleveland and started working at Cleveland Clinic, I realized that's not how most people live. And then about 11 years or so ago, I had a family member struggling with multiple autoimmune diseases. And I had my son, who's now 12. He was a very ill infant. And I saw both of those family members' illnesses progress and get worse, even with all of the things that traditional medicine could offer. I then discovered functional medicine and did different things with lifestyle and food, mostly with both of them, and watched both of their issues go into remission. So that was really, really powerful and kind of kept driving me towards finding a job to be able to do functional medicine full time. So I was blessed about 6 years ago to find a job doing this full time. And it has been the most rewarding and exciting work to work with patients who are really motivated to do things differently and to watch how when we take things away that are impacting us negatively and add things that oftentimes are so simple, really change how we feel and really push us towards this amazing journey of life. So that's my story. And then
Okay. Hi, everybody. I'm Emily Caulfield. I'm another nurse practitioner in the Wellness Center. And so I grew up in a town south of Columbus. I completed my BSN at Otterbein University, and then I became a bedside nurse at a cardiovascular intermediate unit. And then I went on to get my family nurse practitioner certification with Ohio University. So my story sort of begins like early high school when I was placed on hormonal birth control to help with some PMS symptoms I was having. My primary care doctor at the time had just kind of told me that it would help make my periods more tolerable, more regular, and it would also help with the acne that I was also experiencing. So a couple years after college, I was starting to struggle with depression a little bit more, and I was also diagnosed with that at the beginning of high school as well. So at this point, I kind of felt like I was almost doomed, like I was gonna just have to settle and live like this because I was already on medication. There wasn't much else my doctor could do to help me. And then I had happened upon an article that talked about like more natural approaches in functional medicine. And it also talked briefly about how depression can be a side effect of hormonal birth control. So as soon as I saw that, I kind of dove into some research and I talked to my doctor about it. I really just felt like it was something I owed to myself to kind of try, see if it would help me mentally. And I got off birth control, and within a couple months, I felt so much better. So my symptoms that I had originally gotten on the birth control did come back. However, when I was doing my research, I also was learning that a lot of those symptoms are more like signs from your body that things aren't might be a little off balance or might need tweaked a little bit. So through like some dietary changes and some different lifestyle modifications, I was able to make those symptoms a little more tolerable for myself. And then so through this whole experience, I just felt like it would be really rewarding to help other women that were like me and find more natural approaches for their body and just learn about their body and listen to the signs rather than just kind of band-aiding the symptoms with birth control or some other medication. Okay. So first, we're going to talk about the difference between functional medicine versus traditional medicine. So with this, I like to use the analogy of a tree. So in traditional or conventional medicine, we like to focus more in the branches and the leaves of the trees, and everything's very sectionalized. So if we have cardiac issues, you go see a cardiologist. If you have lung problems, you go see a pulmonologist. If you have skin issues, you go see a dermatologist, and so on. And if you do have symptoms, you might take a medication that would help the symptoms, but you don't really get to figure out why your symptoms are occurring. In functional medicine, we like to focus more in the roots in the soil and the why behind your symptoms. So we find that when we focus in the roots in the soil, we can help make sure that the body has everything it needs to function optimally. So things like nutrients, sleep, stress management, and then also just really finding out why these symptoms are occurring. So we don't necessarily want to give you a pill just to help you sleep. We want to figure out why you're not sleeping. So we find that when we focus on the root down there, that a lot of the things on top of the tree that don't really seem to be related actually start to go away or improve. So next, we're going to talk about the approach that we take here in the Wellness Center. So we really do an in-depth investigation into the individual story. So we look at things like their past medical history, their family history, concerns that the patient might be having, how long they've been having those concerns, and maybe even their lifestyle habits. So like their activity, sleep, diet, and stress management techniques as well. Then we also do a pretty extensive evaluation of their laboratory tests. So we look at things like their nutrient markers, we look at metabolic markers, how well they're processing carbohydrates and sugars. We also look at hormonal markers, we look at gut markers and gut health, and then we also look at oxidative stress and inflammation as well. And then with all of this data, we can help create a individualized treatment plan for the patient that really focuses on lifestyle, nutrition, activity, sleep, and stress. And then if needed, we can create a supplement regimen and then also maybe even hormonal supplements and if needed, prescription medicine as well. And we do find that because we have our initial intake questionnaire that we have patients fill out prior to the appointment and the labs prior to the appointment, that the patient is actually able to leave the appointment with a clear plan and an understanding of what was recommended for them. So our process, I talked about this briefly on the last slide. So whenever patients are interested in the Wellness Center, we have them fill out an initial intake questionnaire, and it's pretty in-depth. That includes a lot of the stuff that I talked about in the last slide, like your past medical history, concerns, lifestyle habits, things like that. And then one of the providers will review this questionnaire, and then we will create an individualized lab order for the patient and share that with them. So with your lab order, you can choose to get your labs drawn with us, or you can choose to have them run through insurance. If you do have them run through insurance, we do ask that you call your insurance company first and just give them like a list of the labs that we ordered and the diagnosis codes, just to make sure that they are going to be covered, because the lab order is very extensive and it has a lot of testing that isn't traditionally ordered in primary care. So things like your DHEA that checks your adrenal function, and like your inflammation marker, which is your CRP, those might not traditionally be tested in primary care. So we just want you to make sure that you are getting covered. And then once we get your labs in, we contact the patient to set up an initial review, which is a 2-hour appointment. And I feel like this is the part that's actually the most rewarding for us providers. And I think the patients enjoy it as well too, but we have 2 hours with the patient where we can really sit down, get to know them, get to know like how they're feeling and stuff like that, and how they're feeling about their treatment plan. And I think patients really like it too, because they actually feel like they're being heard for once as well. And then if we do start a patient on hormones or certain supplements, we do like to have their levels rechecked in 6 weeks. And then we do a follow-up appointment at 2 months, just to make sure everything's progressing in the right direction and everything's going smoothly. So who can benefit from the Wellness Center? So primarily people that might have symptoms that there's not necessarily a clear diagnosis for. So things that people might think like, oh, this is just a normal part of aging, or oh, it's just because I'm a woman, or so on and so forth. But we like to think of these symptoms more as signs. So these could be just signs that our body's telling us that something's off, or something needs more balanced, or maybe something needs to be taken away. So some of these symptoms can include fatigue, mood problems, weight concerns, PMS, irregular periods, gut issues, low libido, sleep disturbances, and fatigue. So the different areas that we focus on, so we do focus a lot on hormone therapy and balancing hormones, but we also have found that that's just a really small part to a really big puzzle. So we also look at things like nutrition and metabolics. We look at gut health. We look at adrenal health. Adrenal health is really big and can have a big impact on a lot of the processes in our body. So we do spend a lot of time looking at how our adrenals are functioning, making sure they're optimally functioning, and we are getting good stress management techniques as well. And then we also look at thyroid health and offer supplementation and maybe lifestyle changes, and if needed, thyroid prescription as well. And then of course, hormone balancing. And then hormone deficiency symptoms. So these can really vary person to person, and they can also vary depending on their age as well. But a lot of the hormone deficiency symptoms include weight gain, loss of muscle mass, increase in degenerative diseases such as osteoporosis, cardiovascular disease, and dementia, especially as we get older. Compromised immune system, so you might find that you're getting sick more often, mood issues, trouble managing your stress, fatigue, and then sleep is something that we address a lot, as well as just people that might just not be feeling like themselves anymore. So for the rest of this presentation, we're going to talk more about hormones specifically. But so for hormone balancing in women, we look at estradiol, progesterone, and testosterone. So these things can kind of change at different times in our lives. So in younger women that are experiencing an imbalance of their hormones, they might have absent periods, they might have trouble getting pregnant, they could maybe be experiencing acne or painful periods. And then as women get into their 40s and 50s, they have more of the classic perimenopausal symptoms such as low libido, heavy irregular periods, not being able to sleep very well. And then as women transition into menopause, they can have some hot flashes, night sweats, and vaginal dryness. So we do see women kind of over the years, but it's nice to be able to help them transition through these different periods of their lives and make it as comfortable as possible for them. And then for men, we primarily look at the hormone testosterone as well as everything else that we had mentioned. And men can actually go through something called andropause, which is similar to the symptoms that women experience in menopause. So Julie is gonna take over from here.
Thank you very much. All right. Okay. So to start, some common myths about hormone replacement therapy. Many of you may have heard, either been interested in hormone replacement therapy, you may have friends or family members on hormone replacement and have heard some of these myths about the medications. You'll hear things like they cause cancer, heart attacks, strokes, and blood clots. Those are the big concerns, even personality changes. The problem is all hormones are not the same. It's just not that simple as you take these medicines, these are the things that are going to happen. So when we look at hormone replacement therapy, including the risks and benefits, we always look at the two different classes of medications. So think about Tylenol versus ibuprofen, right? Two medicines that are both used for fever and headache. One metabolizes through the liver, one metabolizes through the kidneys, one can thin your blood, one doesn't. Everybody understands those are two totally separate medicines, but used for the same reasons. So when we look at prescriptions, there's bioidentical hormones and synthetic hormones. The synthetic hormones, think of your birth control pill pack. If you ever actually looked at that pill pack and tried to read the name, they're big, long chemical names that you can't even quite pronounce. The first part usually is CEE or conjugated equine estrogen, meaning it actually comes from horse urine. That equine, it really does come from horses. The second part of that medication is usually some big long thing, that's the progestin, like norethindrone acetate. So that's how you know you're on synthetic hormones versus bioidenticals. Bioidenticals actually have the name of our own natural hormone like estradiol, progesterone, testosterone. So if you look at your pill bottle and it says estradiol, you are on bioidentical hormones. So the difference comes in how they're made, right? They are both man-made, but they're molecularly different structures. So when you make a medication out of the horse urine, they don't fit into the cell receptor very well. They fit well enough to stop symptoms of hot flashes and night sweats or for whatever reason that you're using them, but they don't fit in correctly, so they also cause inflammation. The inflammation, we have found over 50 some years of research, increases your risk of heart attacks, strokes, blood clots, cancers, along with other things. Now, there's also 50 some years of research on the bioidentical hormones, usually made out of yams initially or any other compound, but they're molecularly made to perfectly match our own natural hormones. They fit into that cell receptor exactly the way they should. So all of that research shows the benefit of our own natural hormone without increasing risk. Specifically with estradiol, the kind of classic things that people will use estradiol for are those really common symptoms of menopause. So things like hot flashes and night sweats. Estradiol, think about, is our stimulating hormone. It's the one that stimulates everything in our body. So it stimulates that uterine lining to grow. It stabilizes and increases our mood and libido by supporting serotonin and dopamine production. It stimulates that uterine lining to grow, but not just to then have a period, but to thicken and get ready for pregnancy. It supports bone growth, muscles, brain, heart, the vaginal lining, skin health. A lot of women develop skin dryness, eye dryness with perimenopause and menopause, and that's one of the symptoms of estrogen deficiency. So using estradiol even can maintain insulin sensitivity. So another really common symptom of perimenopause and menopause is weight gain, especially around the midsection. And that comes from a lot of different things. But one of the primary reasons is we become more insulin resistant due to the lack of our estrogen production. So when we replace or rebalance estradiol in women, it relieves those classic menopause symptoms like the hot flashes and night sweats, vaginal dryness, those types of things. But we also really focus on the overall health benefits, things like helping take care of our heart, our brain so we don't get dementia, our bones so we don't get osteoporosis, and all that type of stuff. Now, progesterone is classically only used in women that have a uterus. So if you look at traditional medicine, they prescribe progestin, again, not progesterone typically, but the progestin piece to protect the uterine lining. That's the only thing it's FDA approved for. So a lot of women have had a hysterectomy, they get placed on estradiol, they do not get put on progesterone or progestins because they don't have a uterus. We really focus on all of the benefits that progesterone provides. It protects our breasts from cancer, our uterus from cancer. It helps protect our bones from osteoporosis. It protects our hair from hair loss. It's our calming hormone. So it's that thing that I like to describe as our warm kind of blanket hug. It plays a big role in sleep. We really recommend it in all women in menopause if you're on estrogen therapy, whether or not you have a uterus. We also prescribe progesterone if needed to younger women if they have an estrogen kind of dominant period problem, and all sorts of other things you can use progesterone for to really help with heavy bleeding, PMS symptoms, and it supports fertility as well. All right, testosterone. So first of all, girls have testosterone and boys have estrogen. We both have both. They do the exact same thing for both of us, but in drastically different levels. So testosterone is the libido and sexual health hormone. Most people understand that connection, but it's also the hormone that helps maintain our muscle mass, which strengthens and supports our joints to help prevent joint pain. It helps support endurance. It helps us burn fat individually, and then by maintaining muscle health, you help burn more fat. It takes care of our skin. It takes care of memory and mood and focus and sleep and all sorts of things. So we both need both hormones. Both men and women need estradiol and testosterone. It's that thing that kind of gives us that get up and go vitality, joyful vibrancy to our life. And it's part of those hormones that, you know, we lose when we go through perimenopause and menopause. Now, as Emily mentioned, hormone replacement therapy is one of the primary things that we do here in the Wellness Center, but we have found over and over again, if you don't address all of those areas of health and wellness, we might get the hot flashes and night sweat stopped, you'll feel somewhat better, but it really takes time to gather the whole picture to really feel your best and to get the most out of this wellness journey. So we don't have a whole lot of time to talk about food, but I wanted to touch on a few key points because I do find that the kind of fear that comes around changing your food is one of the reasons why some people are a little bit hesitant to start a wellness journey. And we are very realistic with food. We all, you know, have to manage our own life and our busy life and work and family and try to balance what we should eat and shouldn't eat for our own bodies. The few key principles that we use here at the Wellness Center, and we can really help people down the path of where their bodies should eat, whether it's lower carb or higher protein or higher fat or lower fat based on a lot of the lab work that we do. You know, things like high triglycerides and high insulin help us guide you towards a lower carb diet, that type of stuff. But we really focus on those few key principles of if it's real food, it grows outside in the real world somewhere, you should be able to eat it at least most of the time. And we focus on, you know, water's important and those types of things. Food is the most powerful thing that we do. It's like a medicine and we take it multiple times a day. So if you don't pay attention to food, at least to some degree, you tend to not be able to necessarily achieve all of your goals, but we're here to help make it as easy as possible for you. And we definitely found small changes in food can make a huge difference. A couple other things. So we do offer medical grade supplements here at the Wellness Center. We've spent a lot of time digging into different supplement companies, individual products within those companies to find the best quality products for the best cost. You know, we really value your time and energy and effort, and to take a supplement that then isn't very biologically active or not third-party tested for purity and toxins and those kinds of things, you often end up not really helping yourself. So we try to take on a lot of that work, find the best quality stuff, again, for the best cost, not always the cheapest, but just like food, you don't necessarily want the cheapest supplement. So we carry all of those things here at the Wellness Center to really help get you started on that journey. We also, one thing that's not on the slide is called the GI map test that we offer. It's actually a stool test. So nobody loves to collect a stool sample at home, but it is a very, very powerful thing that we do. So GI symptoms are a really unique and individual presentation for people. So many people think that they don't have gut problems because they don't have bloating or constipation or diarrhea or, you know, pain in their belly. But the GI symptoms aren't that simple, right? So you could have those symptoms, or you could have acid reflux, but you might also have skin issues like eczema or psoriasis or rosacea or just random rashes that you can't explain. You could have fatigue. I met with a patient this morning. It was her 6-month follow-up. When she came to me, she's young, she's 21 years old, if I remember correctly. For years, she has had daily nausea. She's developed food aversions to a laundry list of food. I couldn't even name them all, because every time she eats, she gets so nauseous, she throws up. Now she's also overweight, so clearly there's a GI problem there if you literally are throwing up every time you eat, but you're gaining weight, not losing weight, right? Something's not right. So we did all of her lab work. She didn't even do a GI map because we were able to fix her symptoms without it, but she had high insulin, she had high inflammation, she had some other hormonal issues going on. By controlling insulin and blood sugar, her GI symptoms went away. So for 6 months now, she's had no nausea, no heartburn, no constipation, no belly pain, no diarrhea. She's feeling amazing and finally starting to be able to lose weight. So the reason I tell you that story is because these GI symptoms aren't as simple as my belly hurts. So if we can't kind of correct some of those symptoms with the basic blood work that we do, we offer the stool test called GI map. It's by a company called Diagnostic Solutions. It's about a 5-page report of your gut microbiome's DNA. So it looks at the actual bacteria, both good and bad, viruses, parasites, yeast, worms. Super fun to find a worm in people. It's pretty rare, but I found one. I think I found one. Parasites are super common. They're everywhere. So that's always fun too, and to tell people they have 3 parasites, which is just hysterical, right? And they get, I don't know, people's reactions are so funny, but we have a lot of fun here at the Wellness Center. You may be able to tell by how Emily and I talk about how much we love it. But, you know, we do this GI map, get this gut microbiome, reset things as needed. If we need prescriptions, we prescribe those. We try to do as much as we can with herbal supplements to help protect the good part of the gut microbiome, but still get rid of the bad stuff. And then healing protocols for leaky gut and all sorts of things that develop when you have that gut imbalance. The third thing that I wanted to mention briefly is called Prolon. Prolon is a service that we offer here. It's a kit. It's a fasting mimicking diet. So intermittent fasting is something that you guys may have heard about. It's all the rage right now. Everybody's compressing their eating window. So we all say intermittent fasting because it tends to just roll off the tongue easier. It's a little bit misleading because you are fasting, but intermittent fasting tends to be more of the days where people will go days without eating. What you're doing is compressing your eating window so you don't eat from 10 a.m. to 8 p.m. So you're eating over a 14-hour, what did I just say? 10-hour eating window, yeah, 10, 14, or you compress it to 8 and 16, something like that. Prolon is a 5-day fasting mimicking diet that gives you basically what it's doing is tricking your body into thinking that you're fasting. Over 5 days, it's just enough calorie, the right breakdown of protein, fats, and carbs to convince your body that you're completely fasting, but yet it's a little bit more realistic to do. It's about 800 calories a day. It's this little kit. All the food that you eat is in the kit. There's day 1, 2, 3, 4, 5. It's things like soups, bars, olives, crackers. And then we use it to really help with metabolic reset. So it's not a weight loss plan. A lot of people do lose weight during the 5 days, but what's fascinating is the research that comes out of University of Southern California shows improvement in metabolic markers. So things like cholesterol panel, inflammation markers, inches on the waist, blood pressure, those types of things improve over 30 days when you change nothing else, right? You just do this for 5 days and you change nothing from days 6 through 30. So that 30-day point, and then even 6 to 9 months later, those improvements are still there. So those are things that we offer to patients. When we look at your lab work, we see, okay, we got metabolic issues, something's going on here, we need a really good reset. We can do a 5-day prolonged session. Nutritional therapy and nutrient injections. So this is another thing that we offer here at the Wellness Center. You know, a lot of people do not absorb nutrients well through their gut, right? Imagine this patient I was telling you about. If you have acid reflux issues, if you don't make enough digestive enzymes, if you don't eat enough, if you eat too much, for whatever reason, if you don't absorb well, and there's some genetic things or just kind of inherited things that play into that too, you can only take so many pills by mouth. Sometimes we can do things under the tongue that absorb a little bit better into that blood supply underneath your tongue. The other option is going directly into the muscle, like a nutrient injection with B vitamins, or we have a couple different offerings of IV therapy that actually goes directly into the vein. And I think those are our big things we wanted to touch on. Can you think of anything else, Emily?
No, I don't think so.
Okay, well, let me, we're gonna make our screen a little bit bigger here so we can see you guys a little bit better for the questions.
There we go. Can you hear me, Julie?
Yes.
Perfect. First, I want to thank you for that. That was such a great presentation. I don't think that we can, I know you guys kind of take it for granted, maybe because you do it every day. I don't think we can underestimate how life-changing this is. When you start your wellness journey, when you finally get these symptoms and you find out why you have them and what you're deficient in, and it makes such a difference in people's lives. So we kind of joke about it and be like, oh yeah, I like my GI this or what. It's such a difference. So I'm so excited about it. Tonight we are offering, it's a great promotion. We're offering a wellness package. So it's something to kind of get you started on that wellness journey. So it'll include your blood draw. So it includes that full panel of blood. You come into our office and we'll get the blood draw. It also includes that 2-hour initial appointment. And when they say an initial consultation, I mean to tell you, you get a book. It is the most interesting, fascinating. You get an entire book that breaks down all of your blood work, all of your metabolic work. It's fascinating. And you think, oh my gosh, can I really talk about this for 2 hours? I could probably talk about it for 4 hours.
You can,
Yeah.
it's pretty easy. A lot of times it's the,
I mean,
oh,
so
you
much
have to
information.
go now.
Yeah.
And I know this is pretty weird to me, but I reference that book all the time. Like, what was I at last year? What's getting better? What's getting worse? So it really is a 2-hour appointment. And then it also includes your follow-up, because you're definitely going to want to come back. You need to come back at 2 months and see, where are we? What's getting better? What's staying the same? Do I need to change anything on my supplements? So the package is, there's $175 savings if you purchase the entire package. It's a great package. I'm going to send everybody the email with all the details tonight. So you'll all get that in your email box tonight. So look for that. You can call our office anytime and we'll get you scheduled for that blood draw. So if we have any questions on that, like I said, look for your email tonight. I'm also going to send an actual recording of this whole session. There's so much information that we went over. That way you can fast forward, you can rewind, you can listen to the information again if there's anything that you really kind of thought you wanted to hear a little bit more about. So you're all getting that tonight. But first, we've had some questions coming in. So I want to go back and forth with you guys and get some of these, and some of them.
Can I share one thing real quick, because you reminded me of something great. So one thing to remember, everyone, is the Wellness Center is the long game, right? Like, we are here to help you with your life's wellness journey. So you can do like a one and done type of, I just want to be evaluated. I want to see, like, if you have 0 complaints, right? And you can come see Emily or myself or Dr. Hall, who's the other provider here, and say, I feel amazing, I'm never tired, I sleep perfectly, my periods are totally normal, my weight's exactly where I want it to be, everything's perfect. I actually have seen 1 I've seen one of those people in 6 years. I will never forget her. I know exactly who it is. I can tell you what room I was sitting in when I met with her. And she was not into that like perimenopausal point yet, but most of her friends were having hot flashes and night sweats and stuff. And she said, I just wanted to come and see what it was about. And the only thing that was off on her lab work was her vitamin D. And I had her take vitamin D. And I said, you don't even need to schedule a follow-up. When your hot flashes start, you call me.
Right.
She called about 18 months later. And then since then, I've seen her every, 3 to 6 months to get once we got her hormone replacement right, some of her vitamins started to change, her gut stuff started to change, the weight stuff started to change. Our hormones are what keep us young and healthy. So often when you get to that point in your life, things start to shift, and we're here to help you hold them all together. So for most people, when you come to see us and you're already having symptoms, we see you initially, we see you again in about 2 months with whatever lab work is required for follow-up. And then we typically see you every 4 to 6 months until we get you really feeling the way you want to feel. After that, it's every 6 months maintenance. So we have to make sure that you never fall back to where it used to be, right? So it's not I don't know, what's more of like a one and done thing, like, I don't know. I hope that makes sense.
You know what? I love that story. Good for her for coming in before she had the symptoms, because most people are like me, where I was miserable for years. And I loved my OBGYN, but she just kept giving me a higher dose of birth control. I didn't even need birth control anymore, so that was crazy. And she was great, but she never took the time to draw the blood and look at all those labs. And so it was unbelievable how quickly things could change. And I'm sure you hear it every day, like, why didn't I do this 3 years ago, 4 years ago, 10 years ago, right? I think most people wait until it's so bad that you have to do something. So that's so nice. Good for her.
Yeah.
Good for that woman.
I mean, I could tell you her name, I won't, but I know exactly who it is.
Okay, couple questions I want to get to. Emily, here's one for you. This is a good one. How often will I need a blood draw or lab work if I go through the wellness center?
Okay, that's a great question. So after the initial visit, so kind of depending on what we start with the patient, so if it's hormones or certain supplements, some stuff we do like to check in 6 weeks just to make sure everything's like going on the right direction. So these are things like if we start you on thyroid medication, like if your iron's low, we'll recheck your ferritin, then some vitamins like B12, and then also your hormones as well. If we do start your hormones, we'll want to check those in 6 weeks. Some stuff we like vitamin D and cholesterol, that takes a little bit longer to show up in your blood markers. So that stuff might need checked at like 3 to 4 months, but kind of like Julie said, once we get you more optimally, we can kind of go to every 6 months, and then we do like annual blood draws. But once you're more optimally and your doses are pretty much staying the same, we can do 6 to 12 months.
Right. Perfect. Julie, this one came in, and I can answer this myself, but would the wellness center benefit me after menopause? That's a strong yes.
So maybe what they're asking too is because they didn't start.
Right, exactly. If I wait till
like that perimenopausal time, or if it's been 10 years, we get that question a lot. I've been menopausal for 10 years. My last period was, 15 years ago. We absolutely can see you and work with you. A lot of people will hear the part of that myth that I was talking about with hormone replacement therapy is what we used to do, or even in traditional medicine. The North American Menopause Society is the traditional medicine expert board that gives providers guide on how to do hormone replacement therapy. The recommendations used to be smallest dose for the shortest amount of time, only if absolutely necessary, and stop them as soon as possible, typically within 5 years. So people will have been on hormone replacement for 5 years, they get taken off, and then they ask the question, well, can I restart them? I never started them. I've been menopausal for 15 years. Is this something I can still do? Absolutely. Even the North American Menopause Society in 2017 changed their recommendations. You no longer have to follow smallest dose, shortest amount of time, stop after 5 years. None of that stuff. If you do the right hormone replacement with the right provider who's monitoring you correctly in the right patient, right? There are
Mhm.
patients that it's not appropriate for. Then there is no age at which you have to start them by or stop them by.
I am well past menopause, and I would have a hard time if somebody wanted to take my hormones away from
And
me.
you will find providers that will still do that, they'll still take them away, but as long as there's no medical reason, right? If you have a hormone responsive, newly diagnosed cancer, then
Right.
you have to take a break from your hormones. If there's, recurring bleeding issues where we cannot get the uterine lining to stop bleeding because you have a fibroid or something like that, that needs dealt with, and then we can go back to hormone replacement. But there's all sorts of little things and little nuances like that, and we're happy to answer any specific questions that you guys have about your own personal medical history.
Right.
For the presentation, you can always message in or call in, and we're happy to answer those for you on a one-on-one basis. But yes, you can be on hormones and vitamins and thyroid. And like Emily was saying, if you do a little piece of this, which is the hormone replacement therapy, all of this other pieces of your puzzle are not being put in line. So some people can't do hormones at all, or they don't want to, then we can still work on all these other areas to get you feeling a lot better than maybe you currently are.
Right. Speaking of the question of prescriptions, I did have some questions that came in regarding specific prescriptions. And I let them know that we will email them and be in contact with them for answers, that we don't want to get into specific prescription discussions with the whole group.
It's a little hard.
Okay, Emily, this is a good one. How soon after I get my blood work can I schedule my initial consultation? Good question.
Yeah, so that actually, it kind of really just depends on the provider's availability. If patients are getting their labs drawn with us, when the day that they come in and get their labs drawn, they can schedule their initial appointment.
So they can get on the schedule.
They can get on the schedule. Yeah. So
we've had that question before.
oh yeah.
It takes about a week to get the lab results in and for us to put that book together that Laura was talking about.
And then if a patient gets their labs done outside at like another facility or something, we usually wait until we have a copy of the labs, just because it can take even longer than a week to get labs from an outside place. But yeah, usually if you come here to get your blood drawn, you can get it on the books within a week.
Perfect. And when everyone sees the book that they put together for you, you will understand. Here was a good one.
Yeah.
Can I do the GI map before my consultation, or do I need to wait until after I have blood work and everything to figure out the GI map? That's a good question.
I have a couple of answers for that. So you can do it before your initial appointment.
Okay.
You do it after your initial appointment, or you can do them, you can only do the GI map. So we do see patients that have absolutely no symptoms other than gut symptoms, like energy's good, periods are good, weight's good, but it's like my patient earlier today, classic abdominal pain, diarrhea, constipation, IBS, nausea, vomiting, whatever that you would really put in the GI symptom box. You could just do the GI map. Now that doesn't really apply to the package and stuff today, but if that sounds like your own story, or if you have people that were questioning that, that's always an option.
Right.
Mostly I would say people do it after. So we kind of start with labs and kind of getting you started on some of the lifestyle stuff. Cause like my patient today is a perfect example. We were able to fix it without having to collect the stool sample, which is always easier, but sometimes we have to take that route. So.
Yes, perfect. Okay, Emily, here's a good question. How long will I need to be on hormone replacement therapy?
That is a good question. And there's not a real specific answer to that.
Need is a very specific word too.
Right.
So we have some patients that are probably going to be on them for the rest of their lives because they love how it makes them feel. Some people just really don't like taking medications or don't like having to put the cream on and stuff like that. And so we'll do whatever you're mostly comfortable with. If you do want to start to transition off of your hormones, we can work with you. But there's really no evidence that shows that you need to stop them at any age. Like Julie mentioned earlier, you can really do them for as long as you want.
Yeah, the only reason you have to stop them is medical reasons, and age is not one of those things. So you can use them as long as there's no medical issues, as long as you want to. If you don't want to use them ever, you don't have to. If you want to stop them at 99 and a half, we'll help stop them.
And we'll help you either way.
Yeah.
And like I said, it's really a personal choice, and you really get to know you, and you get to know the patient, and it's a discussion that you have, like,
Mhm.
where are you at, how are you feeling, what are your goals?
Yeah.
It's not
And
that
we talked about 3 hormones for women, right? Estradiol, progesterone, testosterone. Some women only want to do testosterone for the energy, libido support. They don't want to do estradiol, progesterone. Maybe their mom had breast cancer or they have other fears around it. We will go through all of that with you. There's, you know, if you do estradiol, you do progesterone together. Remember I talked about that progesterone's the protector to help balance the estrogen, but you can do progesterone alone. You can do testosterone alone. The other thing Emily just mentioned was creams, right? So there's a lot of different ways to do hormone replacement
Right.
therapy. And that's important to know too. We do pills if it's appropriate, creams, injections for testosterone for men, pellet therapy for both men and women. I don't know if you've all ever heard of pellet therapy, but it's a procedure we do here in the office. It's one of the ways to deliver hormone replacement. So a lot of people will look for that specifically because they know of a friend or someone who also does pellets. The nice thing about pellets is it's actually like a pellet, like a little grain of rice, right? Testosterone and estradiol can both be in a pellet. It's a small procedure we do here. Just make a tiny incision in the back of your hip, kind of by your pants pocket, and you get steady, stable levels on both of those hormones for 3 to 4 months in women, 5-ish months in men, and you don't have to do anything, right? You don't have to take a pill, you don't have to put a cream on every day. So you get a lot of convenience by doing a pellet, and you get really good medical, like stable levels. So there's no up and down, but the creams and the pills work fabulously as well. A lot of people don't want to do a procedure or they don't, you know, so there's options, I guess is the point to that spiel. I don't know.
change at different times. You could start with one and move to the other.
Yeah.
It was actually the last, you really just answered the last
Oh,
question
sorry.
I had, was, do I have to do a pellet? Is there another option? And you just said there's plenty of other options.
Yeah.
Everyone chooses something different.
Yeah, look at us. We're all on the same wavelength.
Well, I want to thank everyone for joining us tonight. If we didn't get to your questions, again, don't forget that we will be answering those via email. I will send everyone the link to this and the link to all the information on the wellness package for tonight. Please, you can either reply to my email or the phone's open tomorrow morning at 8. You can always call our office directly, 614-246-6900, and we can get you scheduled for that blood draw. Thanks, everyone. Have a great night.
You.
Have a good night.
Bye.